We gather today to highlight both the challenges and the opportunities before us. Harm reduction has been repeatedly recognized as an essential element in protecting the health, dignity, and rights of people who use drugs and in preventing avoidable tragedies such as HIV, hepatitis transmission, and overdose. Yet, the gaps in financing and the recent impact of funding cuts remind us of the urgency to renew and strengthen our commitments. To begin our discussions, it is my honor to invite His Excellency Ambassador Rüdiger Bohn of Germany, representing the group of friends, to deliver the opening remarks.
Yeah, thank you very much, colleagues, friends. This session gives me the opportunity to highlight yet again the centrality of the harm reduction approach in saving lives among people who use drugs. We know that harm reduction, which is a set of policies, programs, and practices, is effective, also cost-effective, and not only saves lives, but also contributes to reducing the spread of infections. It is based on scientific and programmatic evidence, which makes it a smart investment. We know that people who inject drugs are at a higher risk of infections and other health complications. According to recent UNAIDS data, the HIV prevalence among people who inject drugs is 7.1%, or to put it differently, people who inject drugs are 14 times more likely to acquire HIV than the rest of the population. Yet, according to UNAIDS, only 2 out of 25 reporting countries have achieved the 2025 United Nations recommended levels of coverage for opioid agonists maintenance therapy, and only 2 of 32 countries have achieved the United Nations targets for needle and syringe distribution. Harm reduction is not to everyone attractive at first sight, and there often exist massive hurdles to its implementation, including societal and legal barriers, as well as insufficient domestic and international funds and a lack of political support. In Germany, harm reduction is one of the 4 pillars of the National Drug and Addiction Strategy that shows preventive measures such as preventing infectious diseases and other drug-related harm are highly relevant to us. The German drug policy is closely intertwined with the EU drugs strategy that aims at improving the well-being of society and of the individual, protecting and promoting public health, offering a high level of security and well-being for the general public, and increasing health literacy. As part of our strategy, we provide funding to the community-based HIV organization Deutsche AIDS-Hilfe, DAH, that supports the implementation of harm reduction approaches in Germany. And let me briefly highlight one aspect of harm reduction work in Germany. We currently have 34 drug consumption rooms where drug users have access to sterile utensils, to counseling, including on safe consumption, and to emergency measures. Substitution therapy is the gold standard in therapy. Treatment with diamorphine is available for many years now and covered for by the health insurance system in Germany. Legal changes in 2023 allow the piloting of drug checking, which involves testing of presumed psychoactive substances for their ingredients and quantities, along with counseling. At this point, we are in the process of establishing stronger linkages between drug checking and drug consumption rooms. However, we also face major challenges implementing harm reduction measures. On the one hand, due to changing drug markets like the increasing availability of cocaine and synthetic opioids, and on the other hand, due to pressures on the healthcare system, such as the shortage of skilled workers. Therefore, we support projects that explore new ideas and adapt intervention measures to new challenges, such as rapid tests for the detection of fentanyl. Moreover, it is highly relevant that scientific exchange regarding research projects and results is promoted in order to implement harm reduction measures as efficiently as possible and provide the best possible support to those affected. Lastly, let me add here that Germany, along with other countries, has been a financial supporter of the work of the UNODC HIV department as part of the joint UN program on HIV, AIDS, UNAIDS, and we encourage other donors to do the same, especially in these times of uncertainties and shrinking fiscal spaces. Thank you very much.
Thank you, Ambassador, for those opening remarks. To frame our discussion today, we will now hear brief presentations from 3 distinguished speakers who bring valuable perspectives on the current state of harm reduction, the experience of communities most affected, and the role of international partners. First, I would like to give the floor to Catherine Cook, Acting Executive Director of Harm Reduction International, who will highlight the latest evidence and funding gaps in harm reduction. Thank you
so much. Thank you to all the organizers of this event today, and thank you all for coming. I am so heartened to see so many people in the room. It's very encouraging. There's never been a more urgent time to be talking about commitments to harm reduction. Today, we're here both to celebrate support for harm reduction and to warn that we're standing at the edge of a precipice with an urgent need for action. Sorry, could I see the slides? Thank you. You can go to the next slide, please. Thank you. Harm reduction is much broader than the provision of needle and syringe programs or opioid agonist therapies, but on the screen here, I'm sharing figures on some of the core interventions that WHO, UNAIDS, and UNODC recommend countries implement as part of health responses. HRI has monitored the global state of harm reduction since 2008. We've seen a slow but steady increase in the number of countries introducing harm reduction into their national policy and adopting interventions. Harm reduction is emphasized more than ever before in international commitments, not by accident, but because it's effective, cost-effective, and a necessary component to reaching global goals. Harm reduction is valued on paper, but it's budgets that are the real value statements. Next slide, please. In low and middle income countries, our most recent monitoring found a 94% funding gap for harm reduction. There's a heavy reliance on donors, most notably the Global Fund, which accounted for 73% of all donor funding for harm reduction in 2022, compared to 31% in 2007. PEPFAR was the largest donor, second largest donor for harm reduction in 2022, contributing 8% of donor investment in harm reduction. In 2023 and 24, there were hopeful indications that harm reduction funding was on the increase from the Global Fund, philanthropic donors, and from PEPFAR. But the dismantling of USAID has had severe impacts on harm reduction and the wider infrastructure that it relies upon. This is not merely a funding crisis, it's a human rights crisis. Each drop-in center that shut its doors leads to a chain of preventable harms, including rising infection and lives lost to overdose. Each peer worker lost means hundreds of clients are disconnected from trusted care. Where harm reduction is domestically funded and integrated into public health care, it's been protected from funding turbulence this year, but too few governments are using domestic budgets to fund harm reduction. Next slide, please. If there was ever a moment to scrutinize budgets and make wiser investments, this is it. It is time to look critically at the vast amounts spent on punitive drug approaches, to take on board the evidence of a failed war on drugs and the damage this has caused, and to redirect investments into drug responses rooted in community, health, and justice. The money is there, but it's spent on punitive approaches that do not work to achieve stated aims of reducing drug use and instead directly impede access to essential health services. Next slide, please. So what are the critical actions we must take? Countries can take decisive action to institutionalize harm reduction and build resilient domestically owned responses. They can divest from punitive drug responses and invest in health and harm reduction. Countries already investing, I know there are many in this room, must champion this approach and highlight the health and social and economic benefits, share experiences of social contracting, community-led and civil society organizations as the backbone of the harm reduction response. Time and again, it is communities that are resilient and innovative in the face of service disruptions and closures, but they must be funded to create and protect sustainable harm reduction responses. We still need international donors. We need a fully funded global fund, and governments and the philanthropic and private sector must step up with strong pledges this year. Crucially, we must all work together to protect those that provide the evidence base for harm reduction and those that monitor and advocate for these approaches. Community-led and civil society organizations working at all levels to hold governments and donors to account are being squeezed. We are losing organizations that do essential work. Mechanisms like the Robert Carr Fund were set up to support this work and must be prioritized, especially now. A streamlined WHO and the threatened sunsetting of the UNAIDS joint programme, of which UNODC HIV unit is part, pose great risk to the future of harm reduction. Governments must protect what has been built over decades and not let it crumble at this critical point. There are no overnight solutions, and these are very worrying times. The commitment of governments in this room brings hope, and events like this are so important. So thank you again to all involved in making it happen.
Thank you, Catherine, for underlining the urgency of bridging the global funding and for highlighting all this critical action for all of us, member states, civil society, to act on. Next, we welcome Aditia Taslim, Advocacy Officer at the International Network of People Who Use Drugs. Aditia will share the community perspective.
Thank you, Mauricio. Thank you, everybody, for your presence here. It's I know that some of you also were in the morning session already. I'm probably gonna repeat some of the things that I'm gonna say. But we know that globally funding for HIV response has never matched the need. And over the last decade, funding has declined, and government and donors have responded to other demands. And the lack of funding has been particularly pronounced when it comes to addressing HIV for people who use drugs. And after decades of research and on-the-ground experience, we know what works to reduce HIV infections among people who use drugs, including reducing drug-related deaths. However, the current global financial and political environment is not enabling us to do so. Thus, we need to ask ourselves, what does sustainability for people who use drugs mean? And what will it look like in the long term, especially if governments aren't truly creating the enabling environment that we need? And where and how can people who use drugs play their role in shaping the global response for a sustainable response to the HIV response and achieve the global targets of 2030? The International Network of People Who Use Drugs recently published a policy brief called No Fix Without Us, which aims to strengthen and sustain the HIV response among people who use drugs. This policy note also highlights the essential elements and demands for a sustainable HIV response for people who use drugs. First, we must create enabling laws and policies to criminalize us. We must abolish any criminal, administrative, or similar prohibition on the use of drugs and possession, purchase, cultivation of drugs for personal use. Enabling laws and policies should also ensure protection against abuse and other forms of human rights violations and discriminations towards people who use drugs. Second, harm reduction and other health services. Harm reduction services should be explicitly mentioned in any national, regional, and global policies and plans for achieving universal health coverage. Harm reduction services should be made available, accessible, affordable, and also acceptable in any context to ensure equitable access for people who use drugs in all diversity, including women who use drugs. Third, adequate financing. Redirect and dedicate funding for services and programs for people who use drugs instead of using that funding for policing, prosecuting, and punishing us. Fourth, creating a strong and engaged community. Respect, involve, and fund us. People who use drugs are experts. Our lived experience can offer what others cannot. Stop seeing us as evil, and governments and donors must remove all barriers that limit access to funding for drug user-led networks and organizations. We may be small, but we are proud and loud. Without us, there will be no end to the pandemic. Thank you.
Thank you, Aditia, for reminding us that people and life experiences must be at the heart of harm reduction. Finally, joining us online is Marijke Windrocks, head of the Strategic Investment and Impact Division at the Global Fund to fight AIDS, tuberculosis, and malaria, who will speak about financing and investment.
Thank you so much. Well, first of all, thank you for organizing this event at such a critical time, as you heard from the previous speakers. And a special thank you to the member states who are attending here today for being part of this group of friends and for creating this policy space for an evidence-based and public health response to HIV and hepatitis among people who use drugs. I'm delighted to be in the panel with Catherine and Aditia, who are representing HRI and INPUD. Civil society and community-led organizations like yours are playing such a critical role in advocating for harm reduction and the rights of people who use drugs. You're amazing. I would like to make 3 points. First of all, stating the very obvious, harm reduction is effective, evidence-based approach and offers excellent value for money. And as a funding institution, that really matters for us. Harm reduction is endorsed by WHO as an effective and evidence-based approach to prevent HIV and hepatitis C transmission. And we're really grateful for all the support we get from our technical partners such as UNAIDS, WHO, and UNODC, who are supporting with their country offices, the country office supporting harm reduction implementation, developing technical guidance, and of course advocacy for better access and for laws and policies that support a public health and human rights-based approach. As Catherine mentioned, the Global Fund is by far the largest donor of HIV and harm reduction programs in low and middle income countries. And also Catherine mentioned that the number of countries that actually are asking the Global Fund to fund the establishment or expansion of harm reduction programs in our current grant cycle has increased quite a lot compared to previous years. So that's a positive. And HIV prevention remains a priority for the Global Fund, and we are fully committed to expanding high impact HIV prevention interventions, such as condoms, harm reduction, and PrEP, including new technologies like LAN PrEP for those who need HIV prevention most, including people who use drugs. For us, harm reduction is a program essential. That means a high priority set of interventions essential and necessary for the reduction of new HIV infections in countries where new infections are driven by unsafe injections. Harm reduction works, as discussed today. And also, if you look through the programs that are funded by the Global Fund, it works. When harm reduction programs are implemented at scale, they reduce HIV and hepatitis transmission among people who use drugs. We also recognize that opiate agonist maintenance therapy, a key harm reduction intervention, supports improved adherence to HIV treatment for HIV positive people who use drugs. Harm reduction has a very strong evidence base for effectiveness, including cost effectiveness, to address HIV and hepatitis, and therefore, as invested, it offers value for money. We recognize the significant gaps in access to HIV that both to HIV and harm reduction services for people who use drugs. And we recognize the large gaps in funding for harm reduction, and the slide that Catherine showed is pretty mind-blowing. We welcome the growing commitments to domestic financing for harm reduction, including countries such as Vietnam and Ukraine. But a successful Global Fund replenishment is our opportunity to continue the Global Fund commitment to financing HIV and harm reduction programs for people who use drugs. Delighted to see that the co-sponsor of our replenishment, the United Kingdom and South Africa, are part of this group of friends. My second message is on stigma and discrimination against people who use drugs, which remains widespread and a key barrier to access to services. As Aditia also mentioned, people who use drugs often face significant barriers to accessing health services, including criminalization, abusive policing practices, and widespread stigma and discrimination. The levels of stigma and discrimination against people who use drugs are extremely high, contributing to higher HIV risk and high levels of violence, especially for women who are more vulnerable to abuse by intimate partners or police, yet access to gender-responsive harm reduction and treatment services remains very limited. The Global Fund has learned some valuable lessons on what it takes to reduce human rights-related barriers and expand access to health services through our grants, as well as through the Breaking Down Barriers initiative. My last message is that meaningful community engagement is critical to comprehensive HIV and harm reduction response. We work with communities of people who use drugs at the global and national levels to ensure they are at the center of the design, implementation, and oversight of harm reduction programs. Nothing about us without us. For example, in Ukraine, community-led organizations such as Volna and Vona have played a critical role in responding to the complex needs of people who use drugs. These groups have ensured continuity of comprehensive HIV services through community-led monitoring, while also addressing barriers to access, utilizing human rights interventions such as community paralegals, and they do that even in a war situation. So, totally awesome. Community engagement is critical to the Global Fund partnership, and this is reflected at a governance level where community voices are actively engaged in shaping Global Fund policies and strategies, and at the national level, this is reflected in the country coordinating mechanism that must include representatives from communities most affected by the diseases. You can count on us to continue pushing for harm reduction interventions, and we hope we can count on you to help us with our upcoming replenishment. Thank you.
Thank you, Marijke, for stressing the importance of sustained and smart investments to save life. Thank you very much to all our panelists and for those important insights. We will now open the floor for short statements of commitment from member states. We encourage delegations to share how they are supporting harm reduction efforts, whether through national financial contributions, political commitments, policy leadership, or engagement with civil society and communities. I kindly ask that each intervention to be no longer than 2 minutes so we can hear from as many voices as possible. The floor is open. I see the Netherlands, followed by Switzerland.
Thank you for organizing this very important side event. And I want to underline the importance of harm reduction, which has long been a cornerstone of the Dutch drugs policy and also remains to be. And as highlighted in our statement this morning during the segment, the Netherlands remains fully engaged in this dialogue and continues to support effective evidence-based approaches to those who need it most. Our harm reduction measures include free needle and syringe programs, methadone and heroin assistance to reduce risks, as well as supervised drug consumption rooms to provide a safe space and prevent overdoses and infections. I also had the opportunity to visit one in the Netherlands, and it's remarkable the impact it has on the community. Other measures also include sexual health education, access to PrEP for high-risk groups, and low-threshold testing and treatment services. These measures are essential for both the individual as for the society as a whole, as they strengthen communities, protect public health, reduce healthcare costs, and uphold the values of solidarity, inclusion, and human dignity. To ensure that effective services are available and accessible to all, while also addressing stigma, discrimination, and the criminalization of people who use drugs, we need to work together with partners at all levels, such as local organizations and communities, youth groups, NGOs, knowledge institutions, and the private sector. Also in the international context, the Netherlands is committed to universal access to sexual and reproductive health and rights, including the prevention and treatment of HIV/AIDS and the strengthening of primary health care. Beyond the availability of services, trust in healthcare is of great importance, with primary healthcare providers playing a crucial role in this. The international commitment is also reflected in the Netherlands' increased contributions that we did to the Global Fund to fight AIDS, tuberculosis, and malaria, as well as UNAIDS and WHO. Thank you.
Thank you, Netherlands, Switzerland, followed by Ukraine.
Thank you very much, Ambassador, dear colleagues. First of all, thank you for organizing this very important discussion today. In a time of political changes, your commitment toward harm reduction is not only welcome, but also very crucial. The last World Drug Report paints the picture of a global market that is growing steadily and shifting rapidly, with serious consequences for people in every part of the world. Supply is increasing, demand is increasing, and violence is increasing. This is another proof that the war on drug and its strategy centered around repression has not achieved the desired outcome. This failure has very serious consequences on people who use drugs, who risk overdosing due to the unknown quality of the substance used, but also contracting HIV and hepatitis by using contaminated tools. However, as stated in the last World Drug Report chapter on the impact of drug use, most of the harms caused by drug use is preventable or can be mitigated. Harm reduction is a key tool in this context. We know that opioid agonist therapy is one of the best treatments for opioid use disorder. We know that drug checking is one of the best tools in allowing people who use drugs to avoid using unknowingly contaminated substances. And we know that needle and syringe exchange is one of the best ways to prevent HIV and hepatitis infection. However, while harm reduction services are implemented in more than 100 countries, apparently 108, it still faces political resistances, most notably here at the CND. Switzerland has remained firmly committed to work toward a better recognition and support of harm reduction. While the political situation is difficult, while the Vienna spirit is set in question, we believe that these challenges should push us to discuss more openly and honestly these questions, which cannot remain a taboo at the CND. Finally, Aditia mentioned early this morning that we are talking different languages here in Vienna, in Geneva, and in the field. And so let's also commit to fill this gap. Thank you very much.
Thank you, Switzerland. I now give the floor to Ukraine, followed by Ghana.
Thank you very much, Mr. Chair, and distinguished delegates, excellencies. Thank you for organizing this side event. For more than 3 years, Ukraine has suffered devastating consequences of Russia's full-scale war. Our hospitals and health facilities has been destroyed. Health workers and civilians has been killed. And the mental health of our people, both defenders and civilians, has been deeply affected, with post-traumatic and stress becoming a major challenge of our society. Yet Ukraine remains resilient and determined. Even under these extraordinary circumstances, we are committed to providing evidence-based support to our people, including life-saving harm reduction services, as well as integrated mental health care for people who use drugs. In August 2025, Ukraine adopted a new national drug strategy for the period until 2030. Its aim is, and I quote, to improve respect for human rights and the social, medical, psychological, and economic well-being of the population through the promotion of the health lifestyle and creation of conditions for it, as well as for improving access to essential medicine, ensuring quality medical and psychological care, social service for those in need, and harm reduction programs. The strategy outlines clear priorities, implementing effective measures to reduce health risk and harm reduction to drug use, ensuring the right to prevention and treatment, including for those in prison and probation services, improving legislation and upholding the principles of human rights, non-discrimination, and the priority of the right to health, including access to harm reduction and opioid agonist therapy. As a new member of the Commission of Narcotic Drug, Ukraine is committed to promoting evidence-based and human rights-based drug policy in line with EU approaches, in close cooperation with civil society and with meaningful engagement of communities of people who use drugs. We also emphasize the urgent need to sustainable financing to ensure the continuity of harm reduction services, not only in Ukraine, but also in all countries of Eastern Europe and Central Asia and globally. We believe that the Commission has vital leadership role to play in advancing this agenda, and Ukraine stands ready to contribute actively to share commitment, invest in a harm reduction, protecting health and services, saving lives. Thank you.
Thank you to the distinguished delegate of Ukraine. Now I give the floor to the distinguished delegate of Ghana.
Thank you, Mr. Moderator. Thanks for this opportunity, and I congratulate the organizers of this event. As we confront the multifaceted challenges posed by drug use, it is imperative that our public health responses remain firmly anchored in scientific evidence, human rights, and general concern for the welfare of our people and our communities. The increasing complexity of drug-related harms, ranging from emergence of synthetic substances to the intersection of drug use with mental health and infectious diseases, underscore the need for comprehensive, integrated, and people-centered health strategies. In Ghana, we have legislative and policy reforms. And in 2020, Ghana took a bold step in drug policy reform by enacting the Narcotics Control Commission Act, which is now shifting focus from criminalization to rehabilitation and reintegration. Under this framework, individuals found in possession of small quantities of drugs for personal use are referred to health and social services rather than facing custodial sentences. This aligns with international best practices and Ghana's human rights commitments. Additionally, Ghana has finalized its draft harm reduction regulation with a goal of obtaining parliamentary approval. Expanding harm reduction services on this topic, Ghana has taken a major step forward with the inauguration of its first harm reduction center in July 2024, and led by the West Africa Program to Combat AIDS and STI and its partners. There's a drop-in center which will provide critical health services for people who use and inject drugs and people living with HIV. This initiative, supported by the Global Fund G7 project, reflects Ghana's commitment to a public health and human rights-based approach to drug policy. So by prioritizing harm reduction over punitive measures, as we've heard earlier, we align with regional and global best practices, ensuring that vulnerable populations receive the health care, treatment, and support they deserve. Now, under alternative sentencing and regional leadership, as part of Ghana's health-centered approach to drug-related offenses, it partnered with ECOWAS, which is the West African Regional Group, to launch a pilot project introducing alternative sentencing options. And this initiative, known as a recovery court, diverts eligible individuals from incarceration to structured rehabilitation programs. By integrating treatment and judicial oversight, we ensure that people with substance use disorders receive support and care rather than punishment. Ghana is committed to evidence-based approaches that uphold health, human rights, and social reintegration through long-term recovery support. The right to health and access to full continuum of care and services, including harm reduction, is a fundamental part of an effective response to health-related harms posed by non-medical drug use. Ghana upholds international human rights standards by ensuring that our health responses value dignity and inclusion through reforms like the Narcotics Control Commission Act of Ghana, and we urge global cooperation to ensure equitable access to health services, especially in low and middle-income countries. And finally, Mr. Chair, Ghana remains steadfast in balancing public health and public safety, always cognizant of international legal obligations stemming from the 3 international drug conventions, as well as international human rights instruments, and delivering on evidence-based health services across the full continuum of care requires a person-centered approach, meeting individuals where they are, addressing their specific needs, and supporting them on their path towards recovery. Thank you.
Thank you, Ghana, for your commitment. Now I give the floor to the EU delegation, followed by Australia, France online, and my own country, Colombia.
Thank you, Chair, and many thanks to Colombia and to the group of friends for organizing such an interesting exchange on the prospects related to harm reduction policies. It is highly instructive for us to hear all your experiences you've been sharing today, the responses that you are developing. As it has already been expressed by the distinguished ambassador of Germany, but also by the distinguished representative from the Netherlands, Europe has been one of the first homes, if we can say, from harm reduction. So harm reduction is featuring in our EU drug strategy for 20 years now. But it's only since 2021, so 4 years ago, that harm reduction is recognized as a separate pillar of drug policy in the EU strategy. So just to say. However, and I'm not going to give numbers, but we still face a lot of challenges at the EU level. We are fully aware of the concerning situation, and we need to do it together, including as our contribution to attain the SDGs of ensuring healthy lives and promoting well-being for all and all ages. Since we are currently evaluating our EU drug strategy, preparing the new strategy, I thought it could be useful to highlight here the few challenges that we are actually facing in Europe in stepping up harm reduction interventions. So as it already been expressed, the context keeps changing. So we have new drugs available, they create new threats, synthetic opioids, polysubstance use. They lead also to new harms that have a health component, but also affect society as a whole and also as well as the environment. So this is also something that we need to take into account. Another challenge is the increase in number and types of vulnerable groups across society, including migrants, people experiencing homelessness, people with mental health disorders. There are many disparities in the availability and quality of health and harm reduction services in prison settings across member states. Another challenge is, of course, to ensure the accessibility of these services following release from prison. So on that front, the limited data on substance use and health in prisons further complicates evidence-based interventions. Another challenge is the presence of information gaps due to insufficient data collection and monitoring everywhere, but it also makes it difficult to assess the impact of harm reduction measures on drug-related death and social outcomes. Finally, and I think the experience of the projects implemented by the UNODC could be interesting in that regard. The coordination between health, social, and law enforcement services is often challenging. So, but it is really essential to ensure the implementation of comprehensive harm reduction programs. So to conclude today, we're convinced that it is important for the EU to continue stressing the relevance of harm reduction policies at all levels, to continue to invest in harm reduction. We're committed to continue stepping up our interventions on different fronts and all the services that we addressed this morning during the session. But we must identify and fund innovative approaches to reduce harm. Our agency, the European Drugs Agency, is here to support us in this endeavor. The mandates have been broadened. It supports us in identifying relevant programs, in assessing new approaches, and in sharing the identified best practices widely. The agency's also increased direct cooperation with the civil society organizations might enable it to identify innovative activities and consider scientifically their effectiveness to minimize the harms. Thank you.
Thank you to the EU delegation. Now I give the floor to Australia, followed by France.
Thank you, Chair. And firstly, thank you to Colombia and the group of friends for convening this important event today. And thank you to all the panelists for your valuable insights. Australia shares your collective concerns and reiterates calls for increased global investment in evidence-based harm reduction responses. And we also agree harm reduction works. For over 4 decades, Australia has prioritised evidence-based approaches to reduce the health and social harms associated with drug use. Our National Drug Strategy commits to a harm minimisation approach. Our approaches are underpinned by a national framework to address drug-related harms, including the transmission of HIV, viral hepatitis, and other blood-borne viruses. The principle of harm reduction is at the core of our framework. As you would have heard this morning, internationally, We have continued contributions to UNAIDS and the Global Fund to fight AIDS, tuberculosis and malaria to support action in our region. We remain concerned by the rising prevalence of drug use in the Pacific, particularly the use of methamphetamine. Australia has committed additional funding to support Fiji's National HIV Outbreak Response Plan, reinforcing our support for locally led sustainable solutions. Australia reaffirms its commitment to working with global partners, including the UN agencies, member states, civil society and affected communities, to improve global harm reduction response and accelerate progress towards the 2030 agenda. Thank you.
Thank you, Australia. Now I give the floor to France online.
Yes, can you hear me well?
Yes.
Thank you, Chair, Ambassador, ladies and gentlemen. Thank you for organizing this very important event. We know that harms of world drug problems continue to rise and directly undermine our progress towards the achievement of the Sustainable Development Goals, whether in health, safety, equality, justice, or human rights. As it had been told by my colleagues, the pattern of substance use as a risk factor for HIV and hepatitis C is also well established, and at the heart of the problem lies also a dramatic funding gap. Yet, we know that evidence-based and cost-effective harm reduction interventions save lives, lower disease transmission, and build trust within vulnerable communities. This is why it is a priority for France to lead the fight against drug use by promoting a health-centered and rights-based approach. In that prospect, France has chosen to place harm reduction at the center of its national and international response. At the domestic level, our national strategy for mobilization against addiction ensures that harm reduction services are entirely free of charge and accessible to all. This includes opioid substitution therapies, a wide network of specialized facilities and innovative services. Particular attention is given to women, as well as to the most vulnerable and marginalized population. Internationally, France has long been mobilized in favor of equitable access to care for people who use drugs, and as the second largest historical contributor to the Global Fund, which is the main funder of risk reduction programs. Through our bilateral program initiative, complementary to our Global Fund contribution and implemented by Expertise France, we have committed nearly 35 million to projects in 28 African and Southeast Asia countries, supporting community-based organizations, national authorities, and research actors. Our message today is clear. Investing in harm reduction means investing in people, saving lives, and building societies that are more equitable, healthier, and resilient. France calls to step up its full political and financial commitment to harm reduction. By investing in life-saving interventions, we can change the trajectory of the global drug epidemic. Thank you very much.
Thank you, Franz, for your statement. Now I give the floor to Colombia, followed by the United Kingdom.
Thank you, Mr. Moderator, and many thanks to the group of friends and to the panelists for their interventions. And allow me to share 3 brief elements that reflect our current commitment to harm reduction initiatives. First, earlier this year, the International Harm Reduction Conference took place in Colombia, and it was led by civil society, by our colleagues from Harm Reduction International, and had the support of the Colombian government. More than 1,000 participants from all around the world gathered to learn from one another and advocate on these matters. Within the framework of that conference, a joint declaration was adopted by Colombia, Brazil, and Uruguay, by which our countries reaffirmed their commitment to building and implementing drug policies grounded in evidence, public health, and human rights, and to strengthening regional cooperation for capacity building, the exchange of lessons learned and successful experiences, the production of reliable data, and the creation of permanent institutional mechanisms of dialogue between states, civil society, and multilateral organizations. Secondly, within the framework of the current session of the Human Rights Council in Geneva, Colombia, together with other states that are present here, introduces a draft resolution to ensure that drug-related matters become a recurrent issue for discussion in that forum. Within this initiative, harm reduction language was, as a conducive measure for attaining the right to health, was introduced, and we hope that it remains in the text. Third, and Colombia recognizes harm reduction as an essential component of public health and drug policies. Our national drug policy identifies harm reduction as a key strategy to reduce the risks, harms, and stigma associated with the use of psychoactive substances. Between 2022 and 2024, the Colombian government tripled public investment in harm reduction projects. 22 projects have been implemented across the country. We are also advancing in the consolidation of more flexible and low threshold services, including needle and syringe programs, naloxone distribution, methadone maintenance, community-based initiatives, and substance analysis. This is a work in progress with important challenges in terms of coverage, sustainability, and intersectoral coordination, but we are committed to scaling up these efforts in partnership with civil society and international cooperation. These actions reflect a progressive and differentiated commitment of Colombia to guarantee the right to health, reduce exposure to stigma and risks, and improve access to health and care services under a framework of human rights, public health, and social justice. For Colombia, harm reduction is not an option, it is a responsibility, it is an effective tool, and harm reductions, as it was said many times before, works. It is about saving lives, reducing preventable suffering, and bringing drug policy as a tool for the protection of human rights, equity, and public health. So finally, we reaffirm our commitment to strengthen harm reduction at home, to promote it internationally, and to share our experiences and knowledge with our partners. Thank you.
Thank you to the Colombian delegation. Now I give the floor to the United Kingdom, and I don't see any more nameplates on United Kingdom.
Thank you very much. First of all, thank you to Colombia and the group of friends for providing this platform for this really important discussion. As you heard this morning, the UK is committed to ending new HIV transmissions in the UK by 2030. In 2022, England met the UNAIDS targets nationally, with 95% of people living with HIV being diagnosed, 98% of those diagnosed being on treatment, and 98% of those on treatment having an undetectable viral load. Injecting drug use accounts for only 1.7% of new HIV diagnoses in England due to long-standing harm reduction measures like needle exchange programs and access to opioid substitution treatment. We would like to offer some practical and specific perspectives from our approach in secure and detained settings. So the National Health Service England aims to ensure that all people in secure and detained settings have adequate access to resources. I'll share some thoughts on how this looks in practice. Health and justice prison healthcare providers provide HIV testing uptake upon reception and offer repeat screening for sexually transmitted infections and blood-borne viruses every 12 months. Arrangements are in place to manage the treatment of those with long-term conditions such as HIV. Harm prevention remains a key area of importance for our health service, which focuses on integrated recovery, ensuring individuals accessing these services are able to access support and advice around harm reduction and psychosocial interventions, as well as medical or prescribed interventions. In addition, there is support for the transition from prisons with the implementation of Reconnect, a care after custody service to ensure care coordination post-release to ensure continued support and treatment. Collaboration with individuals with lived experience remains a priority, ensuring that services are modelled and designed with the voice of lived experience at the core of all decision-making. At the international level, we remain committed to the global fight against HIV, and we are proud to be co-hosting the 8th replenishment of the Global Fund with South Africa. Programmes supported by this fund have saved 70 million lives since 2022 and have cut the combined death rate from AIDS, TB and malaria by 63%. The UK pledged 1 billion in 2022 and is currently considering the next funding cycle. The UK is also a donor to the Robert Carr Fund, a grant maker which funds civil society organisations involved in the response to HIV and AIDS, as well as UNAIDS. We know there's more to do to achieve our 2030 ambitions, and we look forward to working closely and learning together to understand the data trends and agreeing on the most effective strategies on our way forward. Thank you.
Thank you very much to the United Kingdom delegation and to all other delegations that took the floor today. To close our event, it is my pleasure to invite Candice Welsh, Director of the Division for Policy Analysis and Public Affairs at UNODC, to deliver closing remarks.
Gracias, Mauricio. Excellencies, distinguished delegates, colleagues, as we close this important discussion, I wish to extend my appreciation to the group of friends of HIV prevention among people who use drugs and people living in prison settings, and the civil society group on HIV and drug use for organizing today's event and for their consistent engagement in keeping this topic high on the international agenda. I would also like to express special thanks to His Excellency Ambassador Rüdiger Bohn and for Germany's ongoing commitment to UNODC's work in this and in other areas. I would like to take a moment to reflect on both the urgency of the challenges we face and the opportunities that lie ahead. The messages are clear. The public health impact of drug use remains substantial. People who use drugs and with drug use disorders, including those in prison settings, as we've heard, are often among the most vulnerable and are exposed to serious risks of harm. They continue to carry a high burden of HIV, hepatitis, and other preventable health and social consequences. Beyond this, drug use can have far-reaching consequences for their families, communities, and broader societal systems. At the same time, the illicit drug economy continues to undermine development, stability, and security across the world. There is a clear and ongoing need to sustain and strengthen our efforts on the ground, focusing on saving lives and preventing others from taking a potential risky path, as we work in parallel to treat disorders and to curb drug supply and demand. UNODC has consistently emphasized that an effective response must be grounded in science, data, and evidence-based practices, be human rights compliant, and be comprehensive, where public health and public safety strategies are not in competition but work together in concert. Harm reduction is not merely a technical intervention. When grounded in evidence and adapted to local contexts, it can constitute an integral part of a successful public health strategy. Harm reduction interventions can minimize some of the most serious immediate risks associated with drug use, such as the transmission of HIV and other communicable diseases or fatal overdoses. However, while they mitigate risks, they do not eliminate them entirely. To effectively protect public health and ensure individual and community welfare, a truly comprehensive response is required. One that integrates harm reduction alongside prevention, treatment, rehabilitation, recovery support, and social reintegration. Harm reduction is not the end of the road. In fact, for many, it is the first step in a broader progress in engagement and care. UNODC will continue to support member states in implementing harm reduction interventions in the context of drug use as part of national strategies grounded in recovery-oriented continuum of care. From outreach and needle exchange to opiate agonist therapy, from overdose prevention to mental health support, from housing to rehabilitation, UNODC continues to work with governments and civil society partners to strengthen this continuum of care, building bridges across health, justice, and human rights sectors. We are facing a shrinking pool of international donor resources. And yet we need to address persistent barriers to accessing services, including those related to legal frameworks, stigma, and discrimination. We need to strengthen community-based and peer-led initiatives and ensure that our policies and programs are informed by the voices of people who use drugs, those in recovery, their families, and other affected persons. As we leave this room today, let us carry with us a renewed commitment. Let us work together to ensure that every individual can access the services they need and to be supported on a path towards recovery and dignity and inclusion. In other words, let's meet people where they are, but let's not leave them there. I'd like to thank all of you for being with us today, both online, in the room. I know it's a busy week for many, so we're really grateful for your commitment from civil society, from so many member states that also made their commitments, and to our excellent panelists. Thank you very much.
Thank you, Candice. And today we have heard clear messages. Harm reduction saves lives, but it urgently needs champions through political will, through investment, and through community leadership. Thank you all here and online for your participation. And let's keep the conversation going. Have a nice day.